Hi everyone, Dr. Nemechek here. I want to touch on something that's very common, and it's the sudden worsening of behavior in kids with autism. It's fairly common, and it scares the bejesus out of the parents, and I kind of just want you to know what's going on here, and that, they don't really, and they're going to be okay. All right? So if you're doing the protocol, or even if you aren't doing the protocol, and you've got your autistic child and suddenly much, much worse, okay? And this is typically going to be due to an illness when it happens right away. And I'm talking middle ear infection, viral infection, sinus infection. So if you're seeing some little kind of symptoms in that regard, you want to get them checked out and so forth. And I want to explain kind of what's happening. First, I've been seeing this for a long time, and here's a paper I stumbled across that finally, about 2 years ago, they're documenting this. And in this study, they have 141 kids with autism, and they're comparing them to kids without autism, and they start following them. And when they're having these sudden worsening of behaviors, these kids often have a fever or ill, kind of symptomatic in that way. And they talk about the worsening of social, emotional, behavioral, and then some somatic, like physical symptoms during that episode. So we finally, something I've been talking about for a long time, we finally have some literature supporting what we're seeing. Now, out of these kids, you had 141 kids with autism. They had 3 who actually did better, because every now and then I'll have a parent will say, yeah, when he gets sick, he's better. And that's real. There's work into why is that happening, and trying to understand that. But really, the vast majority of the kids, they do worse. And so what's happening here? Okay, why are they worse? Well, these kids, first of all, your blood pressure system is regulated by the autonomic nervous system. This is kind of the master regulator of all your physiology, your hormones, your metabolism, your immune system, your emotions. This graphic here shows all the organs. It's very mechanical, and we have what we call 2 branches, the sympathetic and parasympathetic branch. Here, the sympathetic branch, dilates your pupils when it's dark out, and the parasympathetic branch constricts them when it's sunny out. Okay. Kids with autism have big problems here. Okay, and the problems here typically, when we think of problems in the autonomic nervous system, they come about from injuries, and adults get injuries from physical things, inflammatory things, emotional events. Children with autism, there's potential that they're getting a chemical injury from the propionic acid that gets released with bacterial overgrowth. And so there's still more work to be done there, but there's going to be something like that. These kids all have really bad autonomic nervous system functioning, and there's all sorts of literature about this. It's just kind of esoteric verbiage and stuff. It's hard for people and even clinicians to read and know what it really means. But just take my word for it. It's well documented, these problems we have. Now, the core thing that happens, the biggest problem, that whether you're an adult with a concussion or an autistic child, is you have injury to the ANS, we have trouble controlling blood pressure to our head. Okay? We have low blood pressure in those circumstances, and that means if you have low pressure to your head, it's hard for the oxygen to get into your brain. And the brain basically doesn't function right, and the brain starts panicking. And that's what you see with these infections, all right? So you get an infection, and it'll cause your brain blood pressure to kind of drop. Adults kind of have the same thing, all right? When you carefully interview an adult who's got a sinus infection, they're going to tell you many of these same kind of things. And so I say low brain blood pressure just to kind of make it simple for everybody. Our technical term is cerebral hypoperfusion. That's the technical term for what I'm talking about here. This is what causes regression. Now, they don't really regress. You haven't wiped out any gains. It's just that you can't see them at the moment because think of it like an intense episode of attention deficit disorder is occurring. And because you get this low oxygen, can't focus, can't think well, they have hyperactivity that generates blood pressure by moving muscles, or they need to lie flat. That helps get blood pressure. You get rid of gravity, you get more blood pressure to the head. They have some trouble sleeping. They're craving salt, carbs, and water. Those foods will boost blood pressure to your head. You get anxiety, worsening OCD, more stimming, more aggression, more tantrums. These transitional problems suddenly get worse again. And physically, they can complain of headaches or like tight neck muscles. Okay? It's all temporary. It's just this when your autonomic nervous system is not functioning well, if it's injured or kind of fragile, which is very fragile in kids with autism, stressors can make things worse. Some people, it's sunlight, heat, social stress, here, constipation, here, infections. Okay? So, get your kids, if you see this, you want to get them checked out in case they have a middle ear infection, they need some antibiotics. If they just kind of have a runny nose and stuff like that, you can use some fluticasone nasal spray. It goes by the brand name Flonase. That'll open up the sinuses and can sometimes, within just days, clear the infection, and boom, your behavior's back. So just a little insight to what's going on there. If you want to learn more about all of this, hit the subscribe button, and we'll keep feeding you little tidbits like this in the future. Other than that, everybody have a great day.